Happy New Year, and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. Paul Thomas and Bill Kearney in the studio for another year of life, existence, Health Talk radio.
Unbelievable. It's just, we got here in, we opened in April of 1980, opened our second store in December of 1995. So many, many years we have been successful in Lake County and continue to be, and hope you had a good happy New Year's Eve and New Year's, Paul.
Well, you know, it was probably my 7th or 8th year in a row that I haven't been able to spend New Year's with my wife because I have to work.
That's right.
Out at the casino. I was there from 10 to, well, past midnight, actually. I was on the radio from 10 to midnight, and then they asked me to draw the winners of their big giveaway, and I never really like leaving that place at, past midnight because you never know who's going to be on the road.
Right.
But as I drove through town, I noticed it wasn't as busy downtown as I've seen in years past. I think a lot of people just stayed home this year, and usually where we live, my wife was telling me that you hear the fireworks going off and who knows what, gunshots or whatever. And she said that was a lot less this last year as well. So I'm not, I don't know for sure, but I kind of get the feeling that people kind of took it mellow this year.
Well, I think so. And of course, the drinking and driving, you don't want to be in a trap by the law enforcement, and a needed one, to say so, in this county. But we stayed home also. We had a few couples over and actually made it to midnight. And
did you? Did you notice, though? Let me ask you this: did you notice on TV, and I was watching it, and at the casino too, everybody counted down to the New Year like early? Did you guys see that on TV?
No.
The one in New York, they were like 4 minutes early. The casino started doing their countdown at like 4 minutes till the top of the hour. I was like, what is going on?
I was so glad that the countdown was coming. I didn't pay any attention. I was early. It would have been a good deal for me because we took off the next afternoon and drove to the Little River Inn and had New Year's Day there. And it was just pouring, but there was no one on the road on New Year's. I mean, we didn't come across probably 20 cars. We took 128 through Boonville, and that way there was hardly a car on the road. And then yesterday we had to go down to San Francisco to see a specialist at CPMC, and very few people on the road then going in. Of course, coming out in the afternoon there was quite a group of people, but nothing like I'd seen in the past. So, and those people that, of course, went up to Tahoe, and if they made it up there, the snow is going to be coming down by the feet, and then it's supposed to rain and melt all that snow.
Oh, is that what they said?
So,
oh, boy.
Well, there's two different scenarios depending on who you listen to or who you get on the internet with. But anyway, we're going to talk about some highlights from 2016, and when I went on some websites there, it looked more like lowlights than
I was just going to say, I think people are going to look back at 16 and think, boy, that was a rough one.
And of course, with prescription price increases and the DIR fees and Medicare D plans eating into things, I just looked at my new Medicare D plan, and half the drugs that they paid for before are in a Tier 4 level, which requires you to pay 50% of the cost of the drugs, and we're going to be talking about how some of these things take place. I was almost ready to leave to come in, and I got the Record B and saw all the stuff on opiates. And I know a lot of our listeners get tired of hearing this, but it's going to be a huge thing. Number one, because the government has restricted the production. Number two, the government and the insurance companies have restricted the availability of opiates. And number three, the Obama administration, of course, has gotten involved with billions of dollars to stop opiate addiction. There was an interesting article in the Lakeport Record B, or Lake County Record B, about how seniors are affected by being addicted to opiates. And I was in San Francisco at the California Pacific Medical Center yesterday, and seeing a neurosurgeon that specialized in neurogenic diseases, and the number of people that I saw in that office that were very crippled, and most of them elderly, was unbelievable how they were being treated for their pain. I'm not sure, but we have a tendency as people age to think about comfort other than addiction, and not realizing that a lot of the seniors are on other medications as well that affect their comfort, and a lot of those are central nervous system depressants, which doesn't mean they depress you, but they slow down the central nervous system so things aren't moving so fast, whether it be high blood pressure medication, whether it be diabetes medication, whether it be pain medication, whether it be antidepressants. It's all of those things have a tendency to slow the central nervous system down. At the same time, when you take a drug like that, they do other things that don't only slow down the central nervous system, but the parasympathetic nervous system takes over, and so you have dry eye secretion, you have constipation, you have low motility in the gastrointestinal tract, lots of dry mouth, lots of side effects that occur with these, and then you throw an opiate for pain. And if it was for certainly short-term pain, but many times people do as we did yesterday, we go see a specialist for a specific disorder, and then you don't see that specialist after they give you the therapy, or you get through whatever the acute part of your visit is for, and so they continue to keep you on some of the opiate medication. That was not my purpose or our purpose in being there. But you see the trend that, especially when you're a really defined specialist and you're overseeing a certain disease state, and then you are turned back to your family practitioner, whose responsibility it may or may not be to continue that medication, how those things get out of line. So we're in a new era with healthcare. The first thing I heard, Paul, when I was coming in on your radio station was the Republicans are going to defeat Obamacare.
Yeah, that's Pence's job today, isn't it?
Yes,
right
and reformulate it, and then you hear the Democrats come on and say, there's no way you can do this, it can't be done, and millions of people are going to be without health care coverage. I'm not a politician. I don't ever want to be a politician. And yes, there will be some mistakes that are made, but what the Democrats say was, you're going from Obamacare to no care, and that isn't going to happen. We won't let that happen. I'm in a peculiar position as a pharmacist who dispenses medications. Are we over-medicating our society? Are we not in control of what people are taking and how they're taking it? And our job is to manage the medicine, so it's called medical therapy management. And we are involved in doing that. One of the things they talked about with opiates was the cost of withdrawing an addict from opiate addiction. And it isn't only opiates, it's benzodiazepines too, it's other kinds of medications. And we have to be actively involved as pharmacists, or we aren't going to get the payments for taking care of the medication. So as we develop into this new era, it will be interesting to see how a businessman, opposed to a politician, but he's working with politicians on both the House and the Senate side. Whether they're on other side of the aisle or are they on does not make any difference at this point. We have to provide medical care for our people, and especially our seniors. And what we're hoping is those seniors will not get neglected. The difference we have in today's society is there are more of us. The gray population is increasing all the time. We are all living longer. We see people turning 80 and 90 today that, 50 years ago or 40 years ago, they were dying when they were 65. They want more medication. They when I was in this particular physician's office, he got really busy, but when he found out I was a pharmacist, he said, "I want to pick your brain a little bit at the end of this session," and then he got called away, and we will see him again on our anniversary, which is the 19th of January. So we're going to go down on the day before and celebrate by having dinner, and then go
to the doctor.
Then go to the doctor's office, as so many people do in our age.
On their anniversary, yeah.
And so it will be interesting on the level of care that we get. It seems like once you get in to see a physician, which is difficult in Lake County many times, they are very thorough when they do see you. As our older part of the society, we have a lot more diseases because we age longer. So we will have more and more people with diabetes, more and more people with obesity, more and more people with hypertension, high blood pressure, more and more people with esophageal reflux disease, and how all those diseases differ, and whether or not we need the medication to change that. And then we throw the other thing into the formulary that we're going to talk about later, and that is the cost of the medication. And it doesn't necessarily mean if that medication has been on the market for 50 years that it's going to be less expensive than ever. We once thought that once a patent expired on medication, that we would be able to get that as a generic at a much smaller price. We have Glyburide, which is a diabetic medication that's been on the market for many, many years, and it's gone up 600%. We have EpiPen, who's gone up 1,800%. We have a lot of generics that the people have gotten together, and there was an article in the paper today in the Lake County Record B on how the price has escalated by people from different companies socializing together at a country club or a dinner out and saying, in violation of the Brown Act, saying, let's get together and raise the price so we're all charging the same thing for this medication. That's illegal. It should be illegal, and it's happening all the time. So our number is 263-5252 if you want to question anything we're talking about or have anything to add. Let us know, because we would like to be talking about things that interest you. As you get into your new insurance plans, as of January 1, you will notice many changes, especially in Medicare D. The cost of the plan, if it hasn't risen, your deductible will rise. I was just looking at Celoxisib, which is the generic form of Celebrex. I have to pay 50%, and I've been taking this drug since it came out on the market, and then it was at a tier level. It still is a generic medication, but it's still costly, and it's a tier 4 or 5, meaning you have to use many other drugs before you get to it. Now, if your insurance company is diligent, and you have to make sure they are, when they tell you you have to take another non-sterile anti-inflammatory in place of Celebrex or naproxen or ibuprofen, whatever it is, and you have done that, you just have to tell them that you have done that in the past, and they're supposed to acknowledge that history. So hopefully they will, and you'll be able to get it paid for, so without paying 50%. We all have items that are going to change, insurance companies that are going to change, deductibles that are going to change, fees for getting the prescription itself is going to change. And I know it seems like you may think the pharmacies are getting wealthy off this. Our reimbursements have gone down as much as your drugs have gone up because of pharmacy benefit managers. The people in between the insurance company and the patient are taking an unidentified percent, as much as 10% at times, after the prescription has been filled. So we don't know for sure what we're getting when we get a prescription and it comes up on the screen and said you make $2.50. It could have been that we lost $800 by filling that prescription. So as healthcare changes, we have to change with it. When I was doing the things for the end of the year and I was looking at things, I was kind of surprised that this was on MD Links, and it's something that I get medical news from every day. And for some reason, they pulled pharmacy out of the mix, and the first one that was from June of last year, a mother is claiming that a pharmacy's dosing error led to the death of her 8-year-old son. Now, he'd been taking this drug to control his hyperactivities for 3 years, but last Halloween he immediately had a strange reaction to his medication, and they took him to the hospital where doctors allegedly told the family that the medication caused brain swelling. Now, the pharmacist was filling the prescription the way the physician had written it. The pharmacist had actually consulted with the physician to make sure that dose was what he wanted and that drug was what he wanted, because this medication is used as well as for hyperactivity disorder, is used for high blood pressure, is used many times in addition to other medications for ADHD. So the pharmacy and pharmacist wasn't charged. They're just saying that it may have led to it because he was part of the healthcare team. So then the next one I read is 30 pharmacy staff members were arrested in a money laundering scheme. And this was 30 pharmacists and pharmacy managers in connection with healthcare fraud in the state of Florida. Now, if you're not aware of Florida, Florida has laws that pretty much protect the residents of Florida and pretty much rule against anybody from outside that's suing them. The Miami-Dade Police Department announced in a press release that they arrested pharmacists, pharmacist managers, technicians, checks, cashiers were from 3 different organizations, and they used pharmacies to defraud the Medicare D program. Many times when you go to Florida and other states, you will see an address for a pharmacy, and there isn't anything there. It's just strictly an address. And there's no pharmacy. It's all online. It's manipulated many times by people outside of the country. In this country, they were in another location with that pharmacy address and dispensing medication or not dispensing medication to patients that didn't exist and charging the Medicare D program for it. You'll hear a lot of information in the news about pharmacists being overpopulated and we don't have an excess of pharmacists, but there's been some recent controversy regarding their job prospects, and it's pretty much now time to set the record straight, because reports of weakening pharmacist employment simply don't reflect the national picture, according to the New York Times. I'm not politically oriented to the New York Times, but I get a lot of medical information from that newspaper. The current unemployment rate is about 4%. That reflects the experience of job seekers. And I'll tell you what happens with modern pharmacists today. If you'll notice not the same pharmacist there all the time in my locations, that's because the new generation of pharmacists make a lot of money, and they don't want to work full-time. They make a lot of money per day, and 2 or 3 days a week is enough for them to raise a family, support their husband who may or may not be working, and have a very good lifestyle, buy a home, and it's always difficult in rural areas like this to get pharmacists to make a commitment to the area. We have been very lucky at Northlake Medical Pharmacies to have contract pharmacists as well as employee pharmacists that love the area. Even my contract pharmacists live here. The reason that you don't see the same pharmacist day after day after day is they don't want to work full-time, and they don't have to work full-time to support themselves. So we're seeing a big change in physicians as well, where they would rather work at a Kaiser or a maintenance organization where they have a set amount of shifts and are not on call all the time. And it is quite a challenge for hospitals to hire physicians who want to have their own practice and still be associated with a hospital. So the last thing I have, which was kind of a negative thing on 2016, was about a pharmacist and a technician that quit their jobs in Hawaii. It happens to be in Kauai, where I have a timeshare. After a robber threatened them with a BB gun they thought was a real weapon. So this was in Kapa, and told them that the trauma from the ordeal eventually pushed the pharmacist to quit the profession completely. I had, if many of you have been listening to me very long, have had that experience recently in the last couple of years of a pharmacist that had worked for me forever, and a gentleman came in, and I hesitate to call him a gentleman, came in and right after we'd opened up, walked through the door that was normally locked back into the pharmacy, saw two of my employees putting up the order, put a butcher knife at their throat, and said, "If you make a noise, I'll slit your throat and kill you." And then walked over to my pharmacist and put a butcher knife around his throat and said he wanted all the Dilaudid, which is hydromorphine, an opiate. "I'll kill you if you don't give it to me." So my pharmacists have been instructed to be diligent about a demand like that when someone was robbing them, and they did give the individual the hydromorphone. Unfortunately, he had just gotten out of jail, cut himself with the butcher knife on the way out the door. The police were able to track him to a different location, and of course I lost a pharmacist because of this, and eventually a technician. So our profession is not one that is that's very safe when it comes to that kind of an event taking place. And one of the reasons, and probably the biggest reason, is because of the opiates. When the government cut down on opiate dispensing, that threw them out on the street. So now people are taking opiates from somebody selling them on the street, which have to be, they may be placebos with nothing in them, but characteristically they're usually another drug that's much harsher than Oxycontin or Oxycodone, and it's laced with fentanyl, which is another drug that's Duragesic as a patch or as a sucker that you suck on for people with chronic terminal pain, and now they're dying on the street by taking too much of that drug. When we come back, we're going to talk about a little bit as the opiate addiction and the cost of waking up increases, the links of fish oil to your health benefits, and going to repeat again what you need to do if you think you're having a heart attack or some of your loved ones are. Hi, I'm Bill Kearney from Northlake Medical Pharmacies, and recently I spent some time with some of the students in Mrs. Goodwin's third grade class at Lakeport Elementary School to discuss the importance of taking vitamins. I asked the students, why is it important to take your vitamins, and here's what they had to say.
They give us big, strong muscles. They make us healthy. They help us grow tall. They're good for our eyes. They help us fight colds. They are good for our hearts. They are good for our hair. They are good for our teeth. They give us strong bones.
Northlake Medical Pharmacy, a good neighbor pharmacy, is offering a Healthy Kids free vitamin program to the kids of Lake County. Any child aged 2 to 12 can receive a free 30-day supply of children's chewable multivitamins every month for a year. Simply sign up your children at either of our 2 locations at 347 Lakeport Boulevard in front of the Bruno's Shop Smart. Call 263-1328 or at 5136 Hill Road East across from Sutter Lakeside Hospital. Call 263-6192. The Healthy Kids free vitamin program at Northlake Medical Pharmacies.
They're good for us.
There are many sounds in your day-to-day life. There are sounds that wake you up. Sounds that make you smile. sounds that energize you, and sounds that help you relax. But there are some sounds that can alert you to danger and can help save lives. Wireless emergency alerts, now on many mobile devices, use a unique sound and vibration to bring you information about severe weather events, Amber Alerts, or other emergencies in your area. With critical information from local sources you know and trust, you can be in the know, wherever you are. For more information, visit ready.gov/alerts. Brought to you by FEMA and the Ad Council.
Hi, I'm John Cicada. Did you know that chronic hepatitis C affects approximately 1 million Hispanic Americans? I'm visiting my father today, who's part of that statistic. Each story is different, but for at least 20 years, my father never said how sick he was getting. He stayed silent, never talked over the options with his doctor. If he had, maybe I'd be visiting him at home instead of here at the cemetery. If you still think there's strength in silence, think again. Talk to your doctor about your options and learn more at tunein-to-hepc.com.
When today's veterans come home, they are thanked and honored for their service, and rightly so. But for the veterans of the Vietnam War, there was no hero's welcome. Far too often they were disrespected, ignored, or simply forgotten. Never again. This is David James Elliott. It was an honor to play Commander Harmon Rabb on TV's JAG. The Education Center at the Wall will preserve and display photos, letters, and memories of Vietnam veterans so their stories and service will never be forgotten. Recently, a dedicated group of Americans put together a generous donation to build this center, and now they're asking for your help. From now until Veterans Day, they will match your donation dollar for dollar in order to complete this mission. Help us build it. Please visit buildthecenter.org. Share your photos, your stories, and help us with this important mission to connect our nation's past with our nation's future.
A message from the Vietnam Veterans Memorial Fund.
All right, we're back.
We are back. We have been talking about how the opioid epidemic worsens, and one of the things is the cost of getting people that are overdosed with a needle in their arm, giving them Narcan, which is a reversal because a lot of the people who prescribe, physicians who prescribe opiates, even prescribe the Narcan with it. So it takes about 20 seconds when somebody overdoses like that could be dying. And if they don't wake up, you need to call 911. The fentanyl and the Norco and the oxycodone that people were taking, it's an epidemic that's playing out across America as these lead to addiction, and their place on the street causes people to turn to heroin for the first time. The number of deaths from heroin overdoses in the U.S. surpassed those from gun homicides. And I'm sure the city of Chicago was different than that because they had, 700 deaths in Chicago last year?
It's insane, yeah.
But the number of opiate overdoses has skyrocketed. In some cases, the rising prices make it hard for responders and others to carry. The price of Narcan as well as epinephrine just skyrocketed. The Narcan, the brand name, is more difficult to acquire. And the EpiPen, of course, is another thing that's happening that is too expensive to acquire. The public health experts have naloxone in the hands of the first responders, from the firefighters to police officers. When someone takes too much of an opiate drug like heroin or painkillers, which bind to the opioid receptors, it can cause the body to stop breathing. So this acts as an antagonist that knocks the opiates off these receptor sites and restores breathing and can bring people back in seconds. Now, us as pharmacists dispensing that have to go to, even though we're not administering it, we have to go to a special course to be able to dispense the Narcan if it's not on prescription. It's been available since 1971 under the brand name Narcan, and now is in several generic forms. It may range in price from $1 a milliliter in 2005 to more than $15 in 2014. The newer delivery system range in price from $125 for 2 doses to as much as $4,000. So that's not unique to just naloxone. Prices have been risen for generic drugs across the industry, and in many ways the naloxone story is similar. While the prices of some older generic drugs rise, new delivery system cause higher price tags. I don't know what to tell people anymore. I used to be so proud of the profession of pharmacy, and I'm still proud of, at our level, of the pharmacist being the provider of the medication to the patient, because we have the last contact with that person. It is difficult for me to see the drug companies elevate these prices, and sometimes they justify it by having a new delivery system, by having a patch instead of a pill, by having it injected instead of orally taken, to have it an epidural instead of an intramuscular. So, we have all kinds of toys and things that talk to us, and some people, like Aviso, which is one of the 2 naloxone products, is focused on that as well. The medicine has a list price of, before any discounts, is $125 for 2 doses. So patients picking up a drug at the pharmacy, the majority has an insurance company that pay $10 or less, but some people do not. And there's different forms of Narcan which have different prices. So the list price, which gets a lot of media attention, is a price that really nobody pays. What we focus on is what a patient pays. And what they're saying is if the insurance company is going to pay us $1,000 for the drug, and your copay is $15, we're going to make money, the pharmacy benefit programs, by charging the price that nobody pays. Unfortunately, in the first year, about 75% of the time the physician wrote a prescription, the patient never got the product. We talked about that last week. They couldn't afford it. In order to increase the patient assistance, a company will also cover the whole cost of the drug if you have trouble with insurance coverage. But are you going to stand around while we're on the phone, or you're on the phone, trying to get a drug company or a pharmacy benefit program to authorize what we call a prior authorization to get the medication? Normally it does not happen at that point. When you net all that out, the pharmacy benefit programs say it works. We save money, we make money, and we make the insurance companies pay the cost, and the copay for you, if it goes through, is much less. So because of the difference in insurance companies, some people are exposed to greater portions of the cost of their medications, and those patients feel increases more acutely. For example, Specialty RX, Humira, some of the drugs that are used for MS, they're called specialty drugs. CVS Caremark will not let anybody go to any pharmacy but theirs to get a Specialty RX program. They will charge you maybe $15 or $25 for the copay. If we fill the prescription, they will charge the patient over $1,000 for the copay. Covering patients' copays or giving away medicines for free are some of the channels the big chains are using. At the end of the day, somebody's always paying for it. The chances are pretty good that it's you and me as taxpayers. So we take issue with the price of generic forms of medication, which have risen despite the competition. There are now 4 manufacturers of generic naloxone. One costs $9.20 for 10 vials in 2005. Today it's $109.60. 6 months later, HOSPA doubled the price from what it was 6 months ago to $219, and later in 2014, a competitor's price did the same thing, where we were talking last week about a drug that was especially RX for females. It's up to, we have one store in our group that's getting over $1 million a month, and that's on the East Coast, by the way. So additionally, the list price does not include discounts, and the discounts don't come unless you pursue the drug company or their pharmacy benefit manager company. A lot of people are donating to things to make generic drugs cheaper. I'll just tell you one thing. If you are donating online to anybody, whether, and there are a lot of people that aren't going to like what I have to say, but you get phone calls all day long from this organization and that organization and this organization relating to health care or to police force or making something better in your community. Number one, that isn't going to your community in most cases, if it's done by a teleoperator. Number two, the most you could probably get to your local community is about 18%. If it's somebody you know, and it's an organization that you're familiar with locally, and you donate to it, that money is going to go for that reason. But if you're trying to bail out a drug company, if you're trying to aid in, and I'm a veteran, but Paralyzed Veterans of America, the Wounded Warriors, a lot of those organizations, it costs more to promote that company to do the help, that much of that money does not go to the veterans that we're looking for. I saw a thing on the protection of animals the other day, and they wanted $18 a month for everybody to sign up and take care of this poor dog or poor kitty. And it was a huge advertisement through one of the cable networks. And it went on for probably 10 or 12 minutes. That's very, very expensive. Go to your pet shelter. Go to the county. Go, if you want to help an animal that's been treated poorly, do it locally. I am so fed up with health care when it comes to the people that are asking for, and again, this is my opinion. I'm not going to, I have people that I know very well that work for the United Way, that work for the Red Cross. I would never write a check to any of those organizations that I didn't put the money in somebody whose hand that I know, and not somebody that's collecting for a national organization. So just wanted to cover that because we saw a lot of that in December and November, clear up through Christmas Day. And you will continue to see more. And what I tell them is, if I even answer the phone, I tell them I'm not interested. I spend money locally to enhance people's health care, and I choose to, and I do the same thing with law enforcement. And those aren't lies. That's the truth. So I want to make sure that for the Valley Fire, for the Police Officers Association, for Lakeport PD, for Lake County Sheriff's deputies, that money actually goes to them and doesn't go to a teleoperator who the organization is paying for to get the money. Okay, we all know that fish oil, we've heard anyway, that fish oil is good for you, and the potential benefits of fish oil supplements continue to add up. There was a new study that was published in the Mayo Clinic Proceedings that found evidence that fish oil supplements and omega-3s may reduce heart problems. It adds support to previous research, including one study who found that it can reverse the effects of a high-fat diet. I love fish. Do you eat fish, Paul?
I love fish.
And I love almost every kind of fish.
Yeah, me too.
I eat trout. I eat.
I don't think there's a fish I've had that I don't like.
I don't either. Sardines.
Well, salmon maybe
Oh,
sometimes. I'm not. I'm not a huge salmon fan.
I'm kind of with you there, and,
Yeah.
and that's a very good fish for omega-3s.
Yeah.
But I'll eat sardines. I'll eat herring. I'll eat.
The saltier the better
yeah,
for me.
yeah. Anchovies, only I don't eat them on pizza, but I will eat them in a salad. But they reviewed the gold standard clinical trials as well as population-based studies that showed that those who consume more fish oil had an 18% risk of experiencing heart problems. Meanwhile, in the clinic trials, they were at a higher risk of developing heart disease and those were the people that were going to benefit more from the fish oil. So the validity of these findings, actually linking fish oil with improved heart health, are still being questioned. And I see things all the time in the last year about, are you sure that fish oil is good for you? But the first new review of studies was funded by a group of makers and marketers of fish oil called the Global Organization of EPA and DHA. And additionally, the studies didn't account for possible lifestyle factors. For example, people could have improved heart health, not from omega-3s, but a result of engaging in healthy behaviors like exercising, avoiding smoking and eating. And, to be honest with you, the kind of people that would be interested in improving their body by eating fish or taking fish oil, a lot of time are into their whole body improvement, so a lot of those people would be into that. They can be referred to as omega-3 vitamins because the supplements are a rich source of 2 omega-3 fatty acids. And I think that when you take everything that you've heard online and in the healthcare news and CNN Health and the Mayo Clinic, which this study comes from, WebMD, most of them will say that taking omega-3 supplements are probably not as good as eating the fish. But if you're going to try to improve yourself with omega-3s, which are heart healthy, then and you don't like fish like Paul and I, then take the supplements. It's better than not doing anything at all. And if you listen to what we just said about how long people are living now and how much of preventative health care is really becoming an issue, and that's one of the things that I think we'll have to look at with reevaluating Obamacare. And we talked last week about physicians being paid for the conditions improving that their patients came to them for, and how hospitals are losing physicians because they don't get a fee for service. Instead, they are being judged on performance. They don't like that. That's one of the reasons that it's tougher to bring physicians into a wellness type of environment. Now, what we're hoping, and I'm not going to medical school at this point, but what we're hoping is the medical schools are trying to teach wellness now. And I've had a lot of the physicians and specialists that I have seen lately for people in my family have really been into not so much medication as let's do physical therapy. Let's take this. Let's evaluate exactly what's wrong, rather than just deciding out of the block when you start out, this is what it is, and we're going to give you medication, and this will take care of the problem. We continue to dispense medication when physicians write for it. We continue to call medical practitioners when we feel like there's been an overdose or a decimal point's in the wrong place. I was talking to a neurosurgeon yesterday, and he was typing out things on his computer, and we were suggesting to him how physicians don't like to do that so much because it's all electronic health records, and this happened to be in a Sutter environment where all of the hospitals are linked. And the neurosurgeon said, look, it's made me a better physician. He says, when I start talking about medications, when I start talking about conditions, and I have certain options that show up in front of me, it's made me investigate those those differences, and if I don't research it in front of you, I research it after you leave and find out if there's something that I'm overlooking. So he said in my case, and this wasn't a particularly young physician, not as old as I am, but probably within 10 years, and said it's made us do our job better. So, I think if you dig into what's going on in healthcare, it's still progressing. We're still trying to find ways to not charge you as much money for a lower level of care, whether it's a heart attack, whether it's diabetes, whether it's obesity, whatever it is, we need to find out exactly what it is and not just see a doctor for 10 minutes and say, well, this is what we think it is. What we found out yesterday in taking a friend of mine to the physician was the physician says, I think you do have this disease, but I think there's more to it, and we want to find out because of your lack of comfort exactly what it is. So we know you live a long distance away. We know it's inconvenient for you to come here, but if we can help you have a better level of comfort and maybe stop the progress of this disease, or at least slow it down, we need to do so. Now, if you're one of those people that I talked about that might have a heart attack or a stroke, there's things that you need to do, and they aren't hard to remember, but they're things that are going to save a person's life, or could. Whether it's a heart attack or a sudden cardiac arrest, step one is always calling 911. Dispatchers who can coach you through life-saving measures. You've seen this on television. You may have experienced in real life. They're going to help you save that individual until paramedics get there. You need to, we talked a little bit about this last week, you need to ease the strain on the heart. So if the person is still conscious or possibly suffering a heart attack, get them in a comfortable position, half sitting with the head and shoulders well supported and the knees bent to ease the strain on the heart, and then loosen the clothing at the neck, chest, and weight. Again, if you think this is a repeat of last week, it really is, but I think it's important enough that you need to think about it. So 911, ease the strain on the heart, and then if the person is fully conscious, provide a full dose of 325 milligram aspirin, and to chew it slowly. Why do we chew it? Like we said last week, it develops more surface area of that medication. The more surface area, it's easily dissolved and absorbed into the bloodstream more quickly, and it reaches the stomach, and then it breaks down blood clots, minimizing the muscle damage during a heart attack. And then CPR. So you call 911, you put them in a comfortable position, you have them chew and swallow an aspirin slowly, and then you perform CPR. And the next step is to start the chest compressions. Now, we used to do chest compressions and then 2 breaths and then chest compressions. Now we press hard, about 2 inches deep, and 100 to 120 times a minute in the center of the chest. And the reason that they have decided to do this, rather than two breaths, or the compressions and then 2 breaths and compressions and then the 2 breaths, is that the brain is getting starved. Every time we stop to put 2 breaths, the brain is getting starved from oxygen, and we need to keep that brain oxygenated the whole time. And then if you're in a hotel or a airport or some public place, look for an automated external defibrillator. They have clear instructions, and they're designed for use by the public. You attach the pads as indicated on the machine, and then the machine will walk you through the process. It'll only deliver a shock if the patient's condition indicates that it's necessary. Leave the machine on at all times and leave the pads attached, even if the patient has recovered. So these things you need to I look at these things all the time, and I get things on the internet, and I say, I'm going to remember that. I'm going to remember the 5 signs of a stroke. I'm going to remember the 5 things from a heart attack. But a heart attack is 911 right away. Comfortable position, chew the aspirin slowly until it dissolves, start CPR, and then a defibrillator. By then, hopefully, the paramedics are there, especially if there's a defibrillator there. There's a good chance of you being not far away from a fire department, which even in Lake County can get there more quickly than you ever would think it would. So it's important to utilize all these things when you have somebody having a heart attack, especially because we're in a rural area, and the fire department isn't just a couple of blocks away. It could be a couple of miles away, but you need to be active and do all these things while you are. We're coming up into a new year. We're still doing flu shots, so if you haven't got your flu shots, if you looked at the paper this morning, flu is on the rise in California, and especially in Northern California and Central California. So all of us that travel to all these places to see our families, or their families travel to see us, we're carrying with them a type of a virus that it seemed like we all got. If you'll remember on the radio station last week on the show, you could hardly hear me talk. It wasn't very pleasant. This time it's getting better. Of course, I've had my flu shots, and all of you need to do the same. Remember, if you haven't got your Zostavax, if you're older, get your Zostavax or your pneumonia shots. There's 2 pneumonia shots to get, the Pneumovax 23 and the Prevnar 13, and you need to get the Prevnar 13 if you've never had it. If you've never had either one, get the Prevnar 13 first. We want to remind you that we're always here for you. We are still doing the children's vitamins, the free children vitamins. If you've heard our advertisement lately, heard it on the Raider show yesterday. Very good advertisement about the 3rd graders at Lakeport Elementary School. And get your free vitamins. Just come in. We'll give you a card. Any child from age 2 to 12, you'll sign a card to get that, and then every month come in and we'll give you another one. So we'd like to remind you we're North Lake Medical Pharmacies with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. We're outside the Bruno Shop Smart, 347 Lakeport Boulevard. Give us a call there at 263-1328. Thank you, Paul.
Thanks, Bill, and we'll see everybody back here again next Wednesday at 10 a.m. for Health Talk on AM 1270 and 96.5 FM KXBX Lakeport.